And with me today, I'm joined with Dr. Margaret Rutherford, who is a clinical psychologist, an author, and podcast host dedicated to breaking the silence around mental health. With over 30 years of experience in psychotherapy, she has helped countless of individuals navigate complex emotions, particularly those struggling with perfectly hidden depression, PhD, a term she coined to describe high-functioning individuals who mask their pain behind success and perfectionism. As the author of Perfectly Hidden Depression, How to Break Free from the Perfectionism That Masks Your Depression, Dr. Rutherford has revolutionized the conversation around hidden struggles, challenging the notion that depression always looks a certain way. So she hosts a self-work podcast where she provides insightful, compassionate guidance on mental well-being also. So welcome to the show, Dr. Rutherford or Margaret.
Please call me Margaret. Margaret is just
Margaret.
fine. I had
No
to get tickled
formality.
the way you said that. It sounds, she's had over 30 years of therapy. And I thought, yeah, I've needed 30 years of therapy.
No formalities here, absolutely. Oh, no. Yes, so great to have you here, Margaret. As I was saying before, I listened to your talk and perfectly hidden depression. It's a topic which hasn't been discussed before on this space, and it's so amazing that you're raising this because it's such a huge topic of discussion at the moment with everything that we're seeing online, and there's we were
Yes.
talking about adolescence on Netflix as well.
Mhm.
But yeah, so what was it that inspired you to you know actually raise the awareness around this?
I will tell you on you that it was literally back in 2014, so more than 10 years ago. And I had been writing on a blog, and I hadn't even started the podcast yet. And I thought about, well, what do I want to write about this week? And I thought about the people that who'd walk through my office door, and when they sat down, they would squirm a little bit, feel a little agitated, a little anxious. I'd ask them questions about, any trauma. No, 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 no trauma. Anything happened in your life? Not really. My life's full of blessings, and I don't really know why I'm here. I'm just anxious, or I had a panic attack, or I'm struggling with, a relationship, or I know somebody who worked with you and they liked it. So, I got those kinds of answers frequently. And then what I would discover was if I could develop a trusting relationship with them, that they began saying, well, this probably isn't trauma, but my dad was a pretty bad alcoholic, or my mom and dad divorced when I was 4, and I was never allowed to see my mom, or something. I mean, and they'd kind of laugh and shrug their shoulders when they said it. And what I realized was that the bond these people had was their inability to access or express painful emotion. They just could not do it. They didn't know how. And so therapy became a tool or a technique or a relationship in which I was helping them begin to go inward more. And I literally, so I thought I'll write about those people. And I picked the term perfectly hidden depression out of the air, and I posted it. It was called The Perfectly Hidden Depressed Person. Are You One? I'd never had a post go viral. And it was like it shot out of the park. And then I was writing for the HuffPost at the time, and they featured it. And I literally got hundreds of emails saying, how do you know about this? It's like you're in my head. I've never heard about this. So I found Brene Brown's work. She had written the first book, which of course she's written many at this point. She's a wonderful researcher, and she did talk about perfectionism and vulnerability and shame, but she's not a clinician. So she's a wonderful, eloquent researcher, but and she's helped so many people with her work, but she didn't go as far as I thought I wanted to go, which was I had seen these people become suicidal, and no one even imagined within a slightest thought that they would struggle like that. And it is such a lonely, lonely way to live your life, that no one really knows you well. So, frankly, um, I have told my own patients through the years, well, if you think should exist and it doesn't, then maybe create it yourself. And I looked at myself in the mirror and said, well, maybe I'll start writing about it. And so I did. And that led, I mean, it was just kind of a, one thing led to another, one thing and led to the, I never really wanted to write a book. I never wanted to have a podcast. It was just the podcast became necessary because publishing houses were saying to me, nobody knows who you are, which is true, or was at the time. And so it has been an incredible, meaningful. I'm 70 years old, and it has given me such meaning in my life to talk with people like you and to talk about perfectly hidden depression and to do the TEDx. And I've met some wonderful people, and they've, anyway, I'm like I say, so glad to be here, glad to be talking about it with your audience.
Wow, amazing. Thank you so much.
Sure.
What a journey. What a journey.
Yeah, yeah.
And so is this like a personal journey for you as well? Is this something that you struggled with?
I have certainly, people would say to me, and I would look at myself in the mirror and say, yes, you're a perfectionist, but I think I'm a kind of perfectionist that's actually pretty healthy, what's
Yeah.
called constructive perfectionism. I don't think, I have not really suffered with depression in my life. My struggle is with anxiety. I have panic disorder and I've had it for years. It's much better now, but it has been my Rubicon, so to speak. I have had to really work on anxiety. It runs big time in my family. But
Interesting.
my mother, I
Mm,
would say, was certainly someone who would fit into this mold pretty easily.
interesting. Yeah. So what is it then? What differentiates like your mother, for example, for the likes of you?
Well, for one thing, she was born in a different era, and she never got therapy. She never really understood some of the things that may have happened to her that caused her to have some depression. But she lived her life having to look perfect. And I mean, I don't think I ever saw her without makeup on, ever. And she also had a lot of anxiety, but I really think it was her depression that kind of shut her off from the world and made her isolate. And no one really knew what was going on with my mom. Nobody.
Yeah, I guess it's that era of just get on with it. Shut up.
Yeah.
Yeah. Just
Yeah, and I don't believe in getting on with it. I believe at 23 years old, I went into my therapist office. I went into my first therapist office and thought, I need some help.
wow, brilliant that. Yeah. And yeah, because we talk about toxic positivity a lot as well, and about, just people
Exactly.
sugarcoating situations. So I guess it's around the same realm,
It is.
yeah, people just trying to put on a facade and pretending that everything's great, whereas it's really not. And I'm all about authenticity. I'm all about, being honest, and sometimes it could be quite brutal. But, and if it does end up really making people feel on edge, I just think, well, I'd rather be honest than,
Mm-hmm. Mm-hmm.
actually be dishonest, because for me, at least I can sleep well at night.
Good for you. Well, I'm obviously, you must have some sort of experience yourself with victimization and turning that around and making that into something that you learn from and you're helping other people with it.
Absolutely. Yeah. And so I was trying to think of that actor who committed suicide. Robin, was it? Robbie?
Robin Williams.
Yeah. Yeah.
Mhm.
Again.
Robin Williams had probably had bipolar disorder as well. But he had been diagnosed with a form of dementia that would have left him, I mean, he would have not known who people were. And I've had a patient die of it. I think it's called Lewy body dementia. And he had been diagnosed with that. And he killed himself not long after he found out.
Oh my goodness.
Yeah.
Interesting. Wow. And again, it's that same, situation where to everybody, he was just this amazing, amazing soul. And, he was loved by so many, whereas
Yeah.
he didn't love himself.
Well, but there have been many others. I mean, I don't know if y'all know in Great Britain, the man named Twitch, who was a producer with Ellen DeGeneres and a wonderful dancer, and he killed himself fairly recently, and left some kind of note that said, "I just couldn't live past something that had happened to me." And believe me, in the last what 6 years, I've been contacted by a lot of people who've said my wife or my husband or my friend or my child took their own life, and I had no idea there was anything going on with them. Yeah.
Just sounds
You
like a
know, when they
pandemic,
think
doesn't it?
back on it, they can see hints of it, hints of the person shaming themselves for something or trying to get control of something that seemed so out of control or but the hints were very slight, and I have interviewed several of those people. I'm interviewing in a couple of weeks a woman whose daughter took her own life, and she and her husband have developed this nonprofit called a defensive line because their son is actually a pro football player. But she's turned her devastation into a way of trying to explain to people that, you know, we think of depression as melancholy, or maybe somebody's really irritable all the time, or something like that, and doesn't want to do anything and kind of drops out of life for whatever reason. And frankly, that's just not right. It's not the only way. And we mental health people are so tied into the DSM that we start looking at those criteria. And in fact, I have a voicemail from a young woman who sent me, she said, I I read your book. I listened to your podcast. I knew that I identified with perfectly hidden depression. And I went to my therapist and she said, "You don't have depression. You don't fit criteria."
Oh,
And so,
yeah.
she was just heartbroken because she really liked this therapist. So I'm trying to make sure that that message gets out to the mental health profession. And one of the things I love to do is to train clinicians in this. So, because it's like I can see light bulbs going on, and it's really fun.
That is, so this is an actual area where you actually train people and they
Oh
become.
yeah,
Oh, fantastic. Okay.
yeah, oh
That's
yeah.
really good to
Hmm.
know. Yeah. Oh, amazing then. And is this done like mentoring or is it like a course or?
It's a course. I do it through a group called CEU, and I actually may start to do it on my own because I CEU is. I mean, they're a great training organization, but I think I could offer it myself and for a very reasonable price, and
Brilliant.
maybe get that word out even more.
Yeah. Oh my God. Absolutely. I would advocate that definitely because
Hmm.
like I said, it's just an area which isn't really spoken about at all. So
Mm.
yeah, and you're right. I feel like people, healthcare professionals will just go by the guidelines, but then it's just a tick box exercise. And, you know,
Right.
yeah, and if there's no kind of underlying like trauma, then that's it. Oh no, you're fine. Nothing's wrong with you.
Well, obviously, the TEDx, I mean, we are nearing, in fact, it will probably be tomorrow, 1.8 million views. And I mean, 85,000 people like it or something like that. And there have been almost 2,000 comments. I mean, the comments are so painful, but also helpful to read. I mean, the message is getting out there for sure.
Yeah, yeah, amazing. Wow, thank you for that. Thank you for bringing this to light. We need more leaders like you.
I, I, I don't think I'm certainly, I hope I'm not narcissistic enough to think that I'm the only one in the entire mental health world that's ever seen this. As one of my colleagues here in Arkansas said to me, you've just put a name on something that all of us have known, was a possibility and maybe raised awareness of it. I hope I've raised awareness of it, my one little voice. But yeah, I mean, I don't think clinicians are completely, you know, they have no idea this exists. I think they do. It's just like I said, I happen to put a label on it, and am encouraging them to think about it more. In fact, I did an interview a couple of years ago now with another therapist, and she had watched. Well, I didn't have the TEDx yet. She had read the book, and before we got on air, she said, "I've got to tell you something I'm so excited about." And I said, "What?" And she said, where you say, don't ask them if they ever feel helpless because they'll just say no. Add on to that, if you felt helpless, would you tell anyone? She said, and I did that with one of my new clients.
Mm,
And I asked her, if you felt hopeless, would you tell anyone? And she looked at me, she says, no. And I knew
yeah.
at that point that I was talking with someone who did not know how to express that safely.
Interesting.
Yeah.
Wow. Yeah, but I also wanted to talk a bit about the link of trauma and early experiences, and how
Hmm.
that contributes to the development of PhD.
Hmm.
So,
Well, I mean, people have said, well, what causes it?
mm,
And we have a saying here in Arkansas, which is in the southern part of the United States. There are lots of ways around the barn, and what that means is you can get there in a lot of different ways. So I think basically it's when you're in a situation where either you're told and commanded and told it's not okay to express any kind of painful emotion, or if there's a lack of safety in your home, uh, sexual safety, physical safety, emotional safety, then you shut down those things. So it's perfectly hidden depression is a way to try to protect yourself at first. It's I'm going to shove away what feels bad, and I'm just going to survive emotionally. And it's a helpful thing in many ways. It's a way to protect yourself. What happens though is that you keep on doing that as an adult. And then you can't develop these kinds of trusting, intimate relationships because you can't talk about anything but, you know, what the next task you're going to get done, or your relationships tend to be on a fairly what's the word I'm looking for? Not deep. Like, they're not very deep
yeah.
because you don't ever talk about yourself in a really real way. Um, and so yes, of course, it's about trauma. But again, these people will say, "Oh no, I didn't have any trauma."
Yeah,
No,
exactly.
that's not, trauma. That's like a tornado ripping through your house or your mother dying or something like that, And so that's trauma. Yeah.
Well, yeah, exactly. And so, yeah, I suppose it could be any type of experience, can't it? And I guess what are the other kind of leading causes? I mean, the things that I'm thinking about is, what happens at school, and
Exactly, exactly.
bullying
Well,
and,
another thing, people within minority situations or in cultures that are very difficult,
mm,
the message of their culture or families often get out and be successful. You be the first one who's going to go to college. And that's what we're going to love you for. That's what we're going to support you for.
mm,
And so they're stuck in this place of, I may be doing something that I'm doing it for my culture or for my family, or so that I get approval that may be sort of conditional on their success. And that can be very painful because when do you ever get off that treadmill? In fact, there's a famous researcher, Gordon Flett, who's from Canada, who says, destructive perfectionism means that you're on a treadmill, that you have no power over the incline or the speed. And you just have to stay on it. And so every time an expectation comes up, you have to fulfill it.
Yeah. And I
Or
guess,
you fear losing your status or your power or you're hiding. You won't be hidden anymore.
yeah, and it's like you said, where does it stop? Um,
Exactly.
at what age? I suppose it stops when you get ill, burn out, you know?
Yes, I mean it. I am knock on wood. I have been privy and honored by people beginning to shed that necessity to seem tightly in control of their emotions in my own office.
Yeah.
And because they have come to see me because of my writing about this. And, it's powerful to watch. It's powerful to watch somebody, uh, get tears in their eyes because they've never before allowed themselves, let's say they have a child with special needs and they've never allowed themselves to say, sometimes I get tired, but I won't let myself say that because that means I'm not a good mom. No, it doesn't.
Does
That
that.
means you have two different feelings. You love your child and you are sad about the special needs and sometimes you get overwhelmed by them and all those feelings can go together. They don't cancel each other out.
Exactly. And so, yeah, and again, I see this a lot. I'm a mom and I see it amongst other moms where, yeah, that they just don't feel like they have the right to even complain because, that they should be so grateful that they got kids. And
Yeah.
so, yeah, so I guess, that's,
I, I like to tell the story of I had my son through IVF. Very, very lucky to have him. I was 39. It didn't look good. Even my reproductive endocrinologist said, Margaret, this isn't going to work. And I said, well, let's give it one try. And so we did. And I have a wonderful 30-year-old son. But I went to my gynecologist. I was about 7 months pregnant, very big. I mean, I was huge. And my feet were killing me and they were all swollen and everything. And I was, complaining about it. And he looked at me and said, "Now, Margaret, of all people, you
Mhm.
should be happy you're pregnant."
Oh,
And I looked at him and I said, "You know, of all people, after 3.5 years of infertility treatment, I deserve to talk about my feet."
brilliant.
Right now, my feet matter, and I'm really happy I'm pregnant, but my feet are also killing me. And he said he was sorry. He said, "You know what? I should never have said that to you."
Oh, yes, yeah. Well, yeah, I was also a late mom. I had my first at 38 and my second at
Oh,
42. And
wow.
yeah, and again, I was called a geriatric mom.
Yeah, I know that term well.
Many names. Like, come on, what's with all this labeling? Give it a rest.
Oh, yeah. Oh, you geriatric moms, get over
Yeah,
here.
exactly. I'm
Wow.
proud. Yeah, I lived my life. Yeah. Oh, yeah. So I was going to talk about the dangers of suppressing emotions, from your own experience. What has been the long-term impact of that?
Well, I did, when I first started writing about it, literally, I knew I was trying to figure out what I thought it was, and what were the traits of it. And so I was writing about it on my blog every week and asking people if they identified with it to get in touch with me. And sure enough, after about 3 months, 90 people from all over the world had contacted me. And I filtered it down to about 60 people, but I interviewed all 60 of those people. There was a brain surgeon, there was a account executive, an ad executive, there was a motivational speaker, graduate student, dental hygienist. I mean, you name it. And I asked them, why in the world would you agree to talk confidentially but realistically about your life with someone you don't know, you've never met, some therapist from Arkansas? And I would say some version of this came out of their mouth. I do not want anyone to be as lonely as I have been. It is a terrible life.
Wow.
You feel so alone. And I think that's what happens is that without any kind of, even with your spouse or your partner, or maybe even a best, I mean, you may have a friend who you've ventured into this territory a little bit, but you talk with him or her twice a year, and you're just kind of walking around like a shell. And
Mm,
you are praised, and you accept that praise for being good at what you do, for meeting other people's expectations, for always doing your best. And oh gosh, in America we like people who are perfectionists. We like people who work hard or harder than anybody else, and we put them up on a pedestal. So I just think that that is one of the most painful consequences of this, that you just you're not cared about for who you really are. You're cared about, or you feel like you're cared about because of what you can do for other people. And that's not a good feeling.
no, it's not. It's not. A lot of pressure. Mm.
Yes, incredible amounts of pressure.
Wow, interesting. So yeah, so I guess that's the societal pressures that we're talking about right there. And so how like what or why even do you think that the high functioning individuals actually often struggle to ask for help? Is that is there a lot of shame around this?
Yes, I I've been going around and talking with different organizations of, or at least organizations that have occupations that where the suicide rate is actually very high. And what I noticed that I'm having to fight more in the last 6 months than I've had to fight in the last few years is this idea of, oh, she's saying we need to talk about our feelings. That's woke,
Mm,
you know? And my answer to them is, it's not woke. 1,000 of your construction workers a year die on the job and 5,000 kill themselves. That is a fact. I'm not woke. Maybe I am personally, but I'm not. This isn't me touting that you've got to find some way to begin to open up. And we do have more men doing that. We do have, because of course, you know, they're the gender that tends to get taught that they can't talk about what they're feeling. And that is slowly beginning to change. But we are also fighting this tide of, people who are politically, religiously against that. They are labeling it something very negative, which again, the facts seem to indicate that it's a huge problem. But I think that's a real battle right now, maybe in the world, but certainly in the United States.
goodness. So what needs to change then?
Oh yeah, I've got the answer to that. Do you have like a minute?
Come on.
The entire socioeconomic political environment. No, no, it actually just has to start one person at a time. Um, you know, it is. I've had people that I would never, ever have thought that they would get it. This guy who I worked with one time who was a former prison guard, he was tough, tough guy. And he'd gotten into a lot of fights with prisoners,
Wow.
which probably, I'm not going to say whether that was the right thing to do or what, but anyway, he had a lot of anger in him, but he was no longer a prison guard, and he was finding himself getting incredibly angry with his wife, who he loved dearly.
Okay.
And he came in and he said, I just don't get it. I find myself, when she crosses me, or when she disagrees with me, it's never bothered me before, but now I just can't handle it. And so I had him tell me about his childhood. And sure enough, his father, biological father, had left. And a man who he adored was his stepfather, but his stepfather had also been extremely strict. and had punished them for the slightest of mistakes.
Mm.
So, and punished them severely. Now, again, he loved him. And so he didn't see anything wrong with it. And I said, well, look what's happening now. You don't have an avenue for your anger anymore. That probably was born when you just you wanted somebody in your childhood to say, let's call him David, David, you're doing a great job. So when you're questioned, that child in you that never got told, David, you have great ideas, you're lovable, you're valuable, you're safe. You never really got that message. You got the message you were supposed to be okay because now your stepfather had stepped in, but not the really a really good sense of safety and security. And he looked at me and I knew he said, "You mean something that happened to me when I was 5 would be affecting me now?" And I said, "Yeah, because when your wife then opposes your ideas, you're all over her. You don't have the anger that you used to let out in prison. So now you're just letting it out on her." And he was, wow, I never even thought about that. It's amazing to me how many people don't realize that what happened to you when you were a kid is going to affect the way you perceive things now. And if it wasn't a good message, if it wasn't, and for many of us it wasn't, um, then you have to figure that out. So you can become what I call an emotional grown up.
Yeah. Yeah, no, absolutely. But what, like, do you have any kind of practical strategies for
I have a
any?
book you can read.
Yeah.
No, I mean, it's funny. People will say, "Oh, I loved your book. I read it from cover to cover." And I said, "Well, there are 60 exercises in the book." And I said, "Well, how did you like the exercises?" "Oh, well, I didn't do them. I just wanted to understand what you were talking about."
Yeah.
And I laughed and I, smiled at him and I said, "Well, the real work is in the exercises. You can understand something, but that's not going to change your behavior."
Yeah.
So I mean, and a lot of that stuff is available for free
Mm.
on my website or in my podcast stuff. I talk about the stuff you can do all the time, but it's complicated. You have to begin to connect with at least one person at a time in a real way. You have to really look at your commitment to change. You have to be mindful of how perfectionism and destructive perfectionism that has seeped into every part of your being.
Mm.
Um, you have to look at your belief system, that sort of cognitive behavioral work, and the rules you're following, and how they affect your life now. And are they really good rules for you to be following? Or are they not? Are they not helpful? You have to look at what kind of trauma you had in your life. You have to label it as trauma and then begin to say, I can have compassion and I can acknowledge what happened to me and have compassion for that person. And then you do all those things. And then you can begin to say, this is where I'm willing to risk change. Let's say your trait, because there are 10 traits. Let's say the trait you decide you want to try to address first is always taking responsibility. I mean, you're always got your hand in your air, in the air. I'll do it. I'll get it done because you'll get it done well. And especially if you're worried about it, then you'll be responsible. And if you say, well, wait a minute, what if I go to that committee meeting or I go to that whatever, and I don't take responsibility for anything. I just leave the meeting and I haven't volunteered. I haven't said, sure, I'll do that. And what happens? And one woman said to me, I felt so guilty. And I kept saying to myself, nobody else in that meeting is any less busy than you are. And I felt like a horrible person. There were these feelings of shame that were it just filled her as soon as she said, I'm not going to do it.
Wow.
Um, so those are the things, the emotional shifts start happening after your behavior starts changing.
Mm,
And that's,
interesting.
that takes maybe a long time and a lot of commitment and a lot of work, but it can be done.
Well, I suppose we can all start with self-compassion, that shouldn't
Right.
take too long, just by just talking to yourself more positively, right?
Mm-hmm.
I
Mm-hmm.
mean, is that so hard?
For some people, it is. Mm-hmm.
Yeah.
Yeah. For some people who are just, their thoughts are so entrenched in looking for, the things that are wrong with them, the things they could do better, the things they screwed up. I mean, and again, these are very successful looking people often. So it's not that that shows or that that's anything to. My mother actually was so scared of people seeing through her facade that she began taking prescription medications and she became addicted to them and they ruined her life. But she was so determined that no one would ever see her, anxious or sad or overwhelmed or tired or and so the pills kept her going until they didn't anymore. So, you know, there can be some pretty grave consequences.
Yeah, they can, yeah. Okay. And so, in terms of people understanding that vulnerability actually is a sign of strength, what do you think we can do to change that narrative? Because again, so many people are still so afraid to be vulnerable.
I when I wrote the book, I used the word vulnerability. I don't use that word anymore, and I didn't in the TEDx. If you noticed, I used the word transparency
Okay.
because vulnerability with some people has been equated with weakness.
Yeah.
I'm vulnerable. My defenses are down. And I like stressing the word transparency, meaning I'm going to be honest about how I feel right now. And I can feel afraid and I can feel strong. I can feel angry and I can feel sad. I can feel tired and I can really, love something that I'm doing. I mean, emotions are not either or, they're ands. And so practicing transparency with someone you trust is actually the very first step. Even if you just have to say, I've known you a long time and I've never really told you about myself very much. And the other guy will go, yeah, you're right. And you say, well, I'm going to try to start doing that. And he'll go, okay, well, let's start. I go, no, no, no. That was me starting. Me just saying, I don't really know how to do this. I'm going to be awkward. You know, and and that's where I got to start, and that's fine. That's
Mm,
fine.
yeah, yeah.
Start where you are.
Start where you are. Okay, perfect. I love that. Amazing. So, what's one message then that you'd like a listener to take away about healing from perfectionism and hidden depression today?
Hmm. Well, I have my own working definition of self-acceptance because really the self-compassion, as you've already mentioned, and self-acceptance are really the goals. And here's my working definition of self-acceptance. Neither your strengths nor your weaknesses completely define you, and vice versa.
Mm,
I have three letters after my name that I worked very hard to get. PhD. It was like a pain. It was really hard, but I did it. I've also been married three times.
mm, okay.
I had two very tumultuous marriages early. I was very emotionally immature. I got hurt. I hurt other people.
Mm,
My life was incredibly chaotic for a whole decade. I've now been married 34 years, by the way, again. So happily, mostly, as he would say. Um, I don't think either one of those things completely defines me.
No.
They're both true.
Mm,
They're both facts about me. I'm not proud of the two divorces, but they don't completely define me, either one of them.
mm,
Now, for years, I thought it did. And I had to work through a lot of shame and anger with myself and disappointment. And I had to work through that. But as I did, I began to realize, especially in the last, since I've been doing this work, that that is something that, you have to sit with all of who you are, all of your memories, all of the wonderful things you've done, the, embarrassing things you've done, frightening things you've done, and
Mm,
let them exist and not decide that this one over here, you have to hide behind what looks great and hide that doesn't look so great.
mm.
Um, and that's a wonderful gift to give yourself.
That is, yeah, beautiful. I love that. Transparency.
Transparency.
Mm,
Right.
amazing. Thank you so much. Wow, it's been such a wonderful conversation, Margaret. And where can my listeners find you?
Well, my podcast is called the Self Work Podcast, and it's everywhere: Spotify, Apple, all over. I have a lot of listeners actually from Great Britain. And my website is drmargaretrutherford.com. I blog there every week. You can also find my podcast there. I'm on TEDx. I'm on YouTube. I have my channel on YouTube, which is not so grown. I just have really begun to look into that. I'm not so sure how much I want to do there. Um, and you can email me at askdrmargaret at drmargaretrutherford.com.
Beautiful. Wow. Thank you so much. And oh, in terms of your work as well, is it online work that you do, sessions?
Oh, you mean like
Client.
sessions with people,
Mm.
clients? I can do some. I can't do out of the country because of I'm not licensed in those countries. So I can't do that. I can do some other states because I'm a member of PsyPact, but I can't do international. Psychologists can't do that.
No, okay,
Um,
yeah.
so, but I'll be glad to consult or whatever and help you figure out what's going on. And I also have I have a workbook coming out for the book.
Oh,
It'll be
brilliant.
out this fall. It'll be called the Perfectly Hidden Depression Workbook.
Yeah.
And hopefully it'll be available everywhere.
Excellent. Wow. Watch this space. Love that. Thank you.
Of course.
Oh, amazing. So I hope you all enjoyed the show, my beautiful people. Please do get in touch with Margaret with any questions that you have about PhD, perfectly hidden depression, and not actual a PhD degree. That would be
Or maybe
amazing.
they're the same. Who knows?
Exactly, exactly. I'm sure Margaret would love to hear from you.
I would.
And yeah, yeah. So yeah, but that's all we have time for today. And yeah, stay blessed and take care, my friends. And thank you again, Margaret, for joining us today.
You're so welcome. Wonderful host.
Thank you.